Hey guys, this is Dr. Hub. Today we are looking at the injury around the elbow and its mechanisms. So we begin with the valgus injury. So in the valgus injury, there is a fracture of the head and the neck of the radius. A fracture of the head as well as the neck. And this is of the radius. Next is, it involves a fracture. This is a fracture of the medial epicondyle of the humerus. And also the ulnar collateral ligament injury. So ulnar collateral ligament injury. Then comes the varus injury. So what is associated with the varus injury? In terms of varus injury, there is a fracture of the lateral condyle of the humerus. So this fracture of the lateral condyle. So there is a lateral condyle of the humerus injury, and there is also the radial collateral ligament injury. There is presence of the radial collateral ligament injury. Next is moving on to the hyperextension injury. So hyperextension injury, there is a supracondylar fracture of the humerus. This is supracondylar fracture, and this is of the humerus. So in varus, it was a fracture of the lateral epicondyle of the humerus and the lateral collateral ligament of the ligament injury. In terms of hyperextension, is a supracondylar fracture of the humerus. Next is the axial force. So axial force is nothing but the fracture of the capitulum. So it's fracture of the capitulum, and also the dislocations of the elbow. So axial is a fracture of the capitulum as well as dislocation of the elbow. Then we look at the fall on the point of the elbow. So fall on point of elbow. So what is the injury which is involved? The injury involved is nothing but the olecranon fracture. Olecranon fracture, and also the intercondylar fracture of the humerus. Intercondylar fracture, and this is nothing but of the humerus. To learn and grow daily like this, please do subscribe.